the screen that you can use to call us and ask any questions. Nga Professor Watugambye Bobo ine chibuzo, feel free. The numbers are going to be over the screen, but for the meantime you can use 0788140741, a number ya WhatsApp or to sindikirako message nja kubanjira one, or else you can go on Facebook. The page is Google Day TV Uganda. So take ayo echibuzo cho or submissions, anything you want to contribute on to our discussion tonight. But those that will be interested in calling in, the number will be 0200904010. You can use that number to call in. Later on, I'll be telling you when to. So rachinate tete tutandika ngangenda eri professor okutubuulira kumbera yonna nga bwagirabye before the, I would call it a lockdown, nga president anaba kujja kugamba nti kati bino bikome na bino bikome na biri bikome. Embeera before yali etya nakati mbeera gye tuli mu compulsion eriwaawo eri etya?
In summary, if I can try to summarize this, ladies and gentlemen viewing and listening, you know, we had a phase when COVID-19 was a big talk. We had quite a number of people hospitalized. We lost quite a number of people. And then after some time, around November, December, that was the peak, January, the problem went down. It looked like it took cover. And many people, for some reason, thought that the problem perhaps had gone. I actually had some people even say that it seems the stronger virus, we got a fake Chinese version. Ours does not, it doesn't seem to have kill so many people, make people very sick. But we always knew from the scientific point of view that this coronavirus and the diseases it causes tend to follow the same curve that influenza or flu takes. It's seasonal and it goes with weather. So we always knew and believed that we may enter a bad phase, a phase of crisis, as we entered the rainy season of March, April, into May, and now we are in June, and we are still on the spike. If you look at the graphs, including the graph that the president showed us the other time, we are not yet flattening or even moving the curve down. We are still high, going up. So that's where we find ourselves with so many cases of COVID-19 in hospitals, in the community. In summary, the language we use is that we are in a phase of extensive community transmission. We don't know how many people have COVID-19. The numbers that we are seeing as of now are of those who actually get out of their way to go and test. That's where we get the numbers we are telling you. We are not getting out of the community to test every human being. So we don't know the extent of the problem, but we believe it's extensive. We believe there are so many people who are out there who have the virus, and hopefully majority will survive it.
That is hopefully that most of the people would be in position to survive the virus, but that is when you've done all the necessities, all the prerequisites to make sure that you survive this deadly coronavirus. And well, tugenda kutandikanga twebuuza, why is it that everyone has to come out and take maybe a responsibility, either in the, wherever they are, maybe in a family, in a community, mukaseda ketuli mukano, just like we saw, was it like 2 days ago, tulabi abantu banji ba floodings, they've gone back to the villages, they do not know whether they've been exposed or not exposed, and then the intentions were to avoid people moving from one place to another as a way of combating the spread of the virus. So how would someone come out to stand and be like, oh, maybe I can do this to stop this, especially to those ones that have flooded into the villages?
Thank you very much, Gift. Actually, the permanent secretary in the Ministry of Health has already given an advisory, which I think should be taken seriously. Having observed and seen what was happening in the bus parks and taxi parks, and she came out, I saw her on TV, advising that people who are traveling up country, as much as possible, when you reach there, isolate yourselves, at least for a minimum of 7 days. Because all of you, the way you were traveling, the way you were scampering to get the most convenient means of transport, the people you interacted with, the way you were pushing and pulling, you don't know their risk profile. You don't know whether they were positive or negative. So potentially, when you reach where you are going, isolate yourself for a minimum of 7 days and first see. Otherwise, we run a danger, as the way I saw people moving, of now taking the coronavirus to our old people who were safe back in their villages, and we are going to take a disease to them. So let us follow the advice from the Minister of Health, from the Permanent Secretary, self-isolate and first wait and see before you go out to have fun and socialize with your kin and kith.
But is it possible for people to isolate, especially look at the students that were flooding, to go back to their homes? Do you think is there a possibility?
I think it's possible. This is about our behavior. And quite frankly, what we have seen a very big problem of poor risk perception, but also poor perceiving the danger once one has gotten COVID.
Okay.
What I can tell you is that COVID-19, even for those who go to the hospital, are hospitalized and recover, or even those in home-based care, there is what has come to be described as long COVID. The effects it leaves on the body, even when you have recovered, we don't know how long. Some people will get a certain disabling effects of some level. It could be on hearing, it could be on energy levels, it could be to what extent you can be happy. It could be so many things. We don't know the extent of damage. So as much as possible, you try as much as possible to avoid exposing anybody or even yourself to the COVID-19.
Okay, I think I've heard that very well. Like obviously, that was yesterday. We've seen different districts. Their hospitals are flooded with many patients of COVID-19. In Hoima, they are complaining of the overwhelming numbers. If you go to Mbarara, it's a lot of patients of COVID-19. And if you look through, the doctors report that they do not have enough oxygen for almost everyone that comes up. And you've also had people making contacts. Can I access an ICU bed? Can I access this? Can I access this? Like, and everyone is like, oh, the beds are full, the beds are full, the beds are full. And people are stranded, not knowing of what to do and what not to do. So, Professor, the fact that you sit on the advisory committee for COVID-19 at the Ministry of Health, what do you think can be done before we look at people that have chosen to do home-based care for the treatment? But what about those people that have flooded into the hospitals to be treated for COVID-19?
It's a big challenge. Maybe many Ugandans believe that our hospitals are so elastic that literally if the whole of Uganda fell sick would be accommodated. That's not true.
Okay.
These hospitals are always meant to manage people who have severe conditions. And by the way, people remember that COVID-19 has not taken away HIV, has not taken away malaria, has not taken away measles, has not taken all these other problems we have always had. Non-COVID care is being compromised by COVID because now health workers have to shift to look at COVID. Medication, the priority goes to COVID. even the cost of treating one COVID patient, you would have taken care of so many mothers. So that's how disruptive it is, that it disorganizes and disrupts the healthcare infrastructure. And this healthcare infrastructure is really our last defense. That's what we have. That's why for us in health promotion, we usually say, avoid falling sick, eat well, exercise, do ABCD, keep fit, so that you do not become a client of a hospital. But now we have COVID, which has become a disruptor. It has changed things. And you have very many people piling up, seeking for care. The health workers are overwhelmed. Uganda is not a super rich country. Even if we were rich, we have seen how rich countries have suffered with COVID. They have gambled. You've seen images coming from India, from Brazil. So even if a country was very rich, they still struggle. So as much as possible, that's why we've been talking about the whole issue of let us keep the standard operating procedures. Avoid to fall victim. Avoid to contract the virus. Social distance, wash your hands, and these are very simple behaviors, really. But I find many people putting on masks like necklaces, and I get angry. But I have nothing to do. That's a choice.
Yeah.
But these are simple things we can do. Somebody will tell you, but a mask is inconvenient. Of course it's inconvenient. But is it convenient to be a patient? Is it okay?
To be dead?
To be a patient, to be in ICU, struggle to breathe. So it's very, very important that we appreciate that it's for our own good, and that our health care is not the best, is not at its maximum. We have some deficits, and we do not want to overwhelm them. The way we are behaving in these few months, I fear 5-6 weeks down the road, we may create a crisis in our health units, and we should not do that. So those who have traveled up country in this mad rush, please isolate yourselves for at least 7 days. First, see what is happening. The Ministry of Health is working on home-based care guidelines, which will include even prescriptions, because stop self-medicating. We are having a problem, and we are fearing, and we know this, that you can get antibiotic resistance if you misuse these antibiotics. Some people are taking drugs that are unrelated to what they are supposed to take, or even when they take, they don't even know their pre-existing medical condition.
Yes.
You may have a kidney problem. You decide to take whichever medicine you are taking, which is contraindicated against that. So if you are to be on medication, seek prescription from a health worker.
Well, thank you so much, Professor. Those that have just joined us today, it's Wednesday, and Happy Heroes Day. But well, today we're talking about how can society, especially the families, thrive during this COVID-19 period. How can you thrive as a person such that your health is intact? Yes, you do not need to go to the hospital. You do not need to go there and see what's happening there. Ideally, I don't know how I can emphasize this, but you do not need to. It's not good, and it's never been good. So whatever you're supposed to do, kindly and please do that. Well, I'm still with Dr. Willison Winston, a professor from Makerere University, and well, he's an associate professor of the behavior sciences and mental health in the Department of Psychiatry, that is in Makerere University College of Health Sciences and School of Medicine. He's also a member of the Scientific Advisory Committee of COVID-19 at the Ministry of Health, and for him is concentrating so much on the psychosocial and the mental health pillar. Well, we've seen earlier, that was last year, we've heard of symptoms of cough, symptoms of cough, which is dry, like fevers. We've heard of the general body weakness or the malaise. But while COVID-19 is being advanced, just like Professor has told us, and there are a number of symptoms which most people do not know or they are not aware of. But then before we go into those physical symptoms, there are mental effects or impacts that COVID-19 has put onto our lives or your life, and where you're not sure. Sometimes you'll be like, oh, maybe it's the economy, or maybe because I do not have money, but trust me, or maybe it's the COVID-19. Let me ask Professor Winston to take us through what are some of the effects that COVID-19 has brought onto individuals.
Yeah, there are quite many. You can't exhaust them, but I will mention a few. Certainly, we have people who have lost their dear ones, and not just one, but quite a number of dear ones. As I told you, it's highly infectious. So you find some family, they've lost a household head, they've lost the deputy at the household head, they've probably lost another family member. So we are having situations of what we call pathological grief. You are grieving for 1, 2, 3, 4, 5 people, or friends or relatives. Pathological grief is very disabling. Somebody goes to work but cannot concentrate, actually breaks down at work, or if he tries to work, things can't come out, lack of energy, general lethargy. We have people going into states of severe psychological distress and depression because of this COVID. Quite a number of people have lost sleep, have lost appetite,
True.
cannot concentrate on any task, want to talk about COVID every day at any time, so they go to work, they don't work, they are not effective. So that's a very big problem. Young people, and this one is, in this phase we are even seeing young people in serious disease states. So there is a lot of anxiety, pathological anxiety. You know, you can be anxious about something. If you're going to get married, you are anxious.
Yeah.
But the anxiety I'm talking about is different. It's a disease, which is of such a kind that you will not be able to sleep, you can't concentrate, you fear to step out, yet you fear to be inside the house,
Yes.
You are restless. So all these are complications that are associated with COVID-19. And ultimately, think about the health workers, the burnout they go through, where you wake up every day to put on that protective mask and you go to the ICU and you have so many patients that are struggling for their lives. And we still remain human. You know, a simple mistake, COVID can break through that barrier.
Yes.
And get to you. So you put yourself in the shoes of those gentlemen and ladies that step in the ICU, and that's their workplace every day. And they have to go back home and happily talk to their spouses and children. It's hard. They are seeing death every day. They need counseling themselves. They need support. I go to Butavika to do some of my work, and you quite see quite a number of people breaking down. Some people have decided to start even abusing alcohol and other substances to try, and because they try to run away from reality.
Or maybe, Professor, if I may ask, do we still have people that are in denial if it comes to COVID-19?
Yes, we still do. Unfortunately, we still have some people, and that's why you find the common saying I hear in Kampala here is the Mitima Jakaruba. Now, in Mitima Jakaruba, that's the person who is in denial. It's like,
oh, really?
Let come what may, for me, I have to survive. I am not going to do what you are talking about. If you go downtown and you see the people are struggling, certainly for good reason, survive, put food on the table, because they are like, COVID, it's far, it's not close, but it's not far. It's very, very close. And I wish we can remain as resilient and as hardworking as we want to be, but be mindful that once we work hard and bring this money, we should live to enjoy the money. Okay. Otherwise, you can work hard, you can put food on the table, and you have no appetite to take it because you are sick. Yeah.
Okay. Well, thank you so much, Professor. It's never been enough time to talk about COVID-19, but today we're going to try to hint about a few things here and there. We've seen people running to pharmacies. We've seen people running to hospitals, and actually some of them come with their prescriptions. They tell you, I want this and that for these days for. like they've become their doctors. That is the self-prescription you talked about. And I've seen people taking many antibiotics. So as a member on the committee, the advisory committee for COVID-19, what's the picture? What do you have in place to combat or to stop the practice that people have adopted to of moving into pharmacies, getting, okay, I read about this drug online and then I'm told it can work on COVID-19, or maybe it's like a prophylaxis, because we've seen people abusing drugs here and there. Actually, it's at its peak.
It's a very big challenge. It's something that has been talked about, and we are certainly very worried that this unregulated use of medications. These are drugs. These drugs can be poisonous if they are taken without regulation by the people who know them. So it's irrational to take to self-medicate. I want to encourage as much as possible people who are not feeling well, approach a health worker. Describe what you are going through. The health worker will do a brief history of who you are, whether you have this, whether you have that, whether you sleep well, what your conditions you have in your family, to be able to determine which medication is appropriate for you. Self-medication is dangerous. One of the biggest problems we are anticipating with this unregulated self-medication or medication based on social media, we are likely to get drug, especially antibiotic resistance.
Wow.
And later on you will get a very simple infection, but because your body developed resistance, or the antibiotics can't work and will not help you. So as much as possible, let us not self-medicate, where somebody can go to the pharmacy with a prescription and get medication, but don't share his prescription and you buy that medication, because you are not the same. Even if you are twins, you are not the same. Your body weight may differ, your pre-existing medical conditions may differ. So let us leave the health workers to do their job, to help us. They have helped us in the past. They have managed our health problems. They will manage now.
Any restrictions put onto the people in the pharmacies or in the clinics or wherever, the drug shops that give out these drugs? Or
I think the Ministry of Health and other appropriate regulatory bodies are alive to what is happening, and of course there are so many professionals that participate in the supply chain. So there are guidelines and different cautions that are given to the people who deal in medication and drugs, but in my view, from my vantage point as a behavioral scientist, I want to speak to the people who go, because if you don't go, then this person who is in the drug shop will not force you to buy. It's okay to go and buy drugs from a pharmacy, from a drug shop, but go with a prescription from a health worker.
And this is what happens. Most people that have tried to go into hospitals who are told to test for COVID-19, they've been requested a particular amount of money. And I've tried to surface to talk to a number of them. They are complaining about the amounts that are being charged for the test. What is going to be done about that? Because someone, if they come and they want to be tested and yet they do not have the money, are they going to be treated clinically without the test, or what is going to be done about that?
Now that one goes into the whole aspect of now business, because the tests, I know, I have also tried to assess some people to test, and the test has been high. It's still high, especially the gold standard, the amount you need to do a PCR test is a little bit high.
Which is 250 around there.
Yeah, that's a bit high for many people. But fortunately, these days, there are rapid diagnostic tests.
Which is 100, and it's expensive.
Well, it's still expensive. But if one has been a contact and has started to develop certain symptoms, and you got the health worker, and the health worker confirms your husband or your sister who has got COVID, and you are displaying these signs and symptoms, the health worker can clinically on the basis of that history, give a prescription on the probability that you may be a case now. You are no longer a contact. We have not yet gotten free testing. Initially, in the first wave, there was free testing, but it was certainly expensive. But as much as possible, if you cannot afford to have either a rapid diagnostic test or a PCR test, and you can't pay for that, at least go to a health worker, give your history. The health worker can make a judgment based on what you've told him or her to advise you on what to do next.
Well, as we try to go into, actually not even try, we flood those hospitals and try begging the health workers of, I want to test. Actually, some people, I've seen you complaining of, that's a lot of money there. We were told the thing is for free, but Professor Winston has told us it's not for free. There is a cost attached. Before, in the first wave, it was free of charge. And all now we can admit to that we are in the second wave of COVID-19, and it's ceasing to be free of charge. To your surprise, maybe in future, I don't know, you will even get to know that the vaccine is also at a cost. So to avoid all that, kindly, please, follow all the standard operating procedures put up by the Ministry of Health, and you will be in position to not being exposed to this deadly virus of COVID-19. The number is 0200-904010, or you can use our Facebook, which is Good TV Uganda, or well, you can send us a message on WhatsApp on 0788-140-741 for us to interact with you. Professor is still here with us. You can ask him any questions about the apparent situation of COVID-19 in Uganda. And just like I told you, is a part of the advisory committee of COVID-19 at the Ministry of Health. Well, as we continue, the numbers are over the screen. Professor, well, I think Tetugenda kutunulira nnyo the big picture of what COVID-19 is done to the country, but let's see the social impact of COVID-19 to this country.
It's great. It's massive. You know, Ugandans are very happy people. They like to have fun. They like to enjoy their sporting activities. They want to go and cheer their heroes. All those have gone. People hang out. Kampala never sleeps. People go in the bars and places of happening. All that has been disrupted. That social life that has gone away. You know, for me, I'm from Western Uganda, and when we greet, we hug. You know, we hug. You have to feel the temperature and heartbeat of the other person. Now you can't do that. You have to give a arm, and that's a bit strange. So social life has changed in a very big way. The interaction, it has become a bit difficult to depend on just phone contacts so that you.
Hello. Yes, please. Your names and where are you calling us from? Yes.
Hello?
Hello. Okay, producer Kansaboyo Soko Mujeko, if you're trying to call the studio, kindly make sure that the volume of your TV is completely to zero, or you can move out of your house and then make that call. If not that, help us and reduce the volume of the TV. But the number is over the screen, 0200-904010. Kindly, you can try and call us again, but make sure the volume is off. Yes, Professor.
Yeah, so I was saying that there have been lots and lots of impacts on our social life, negative impacts, but that's the cost we have to pay if we are going to survive.
Yes, please. Hello.
Yes, good evening.
Good evening. How are you?
I'm fine.
Your names and where are you calling us from?
I'm Mayambala.
Yes, Mayambala.
Thanks for the show.
Welcome.
100%. How can someone who's like having COVID-19 without the test, as you can call it, maybe a playable test, a playable case, yeah?
How can
someone
mm,
come to the conclusion that he's having COVID-19, but in a probable case without any test? Yeah, that's what I wanted to know. But thanks for the show.
welcome Mayambala? He's asking how can someone prove that they have COVID-19 without testing, Professor?
It's tough. Whichever, that's very tough. But if you have been in contact with somebody who had COVID, you start sneezing, you start coughing, you start having those fevers, you lose the sense of taste, you lose the sense of smell. Then you are entering a phase, a zone of saying probably I have, probably I have, and of course it's probable until then now you go to health worker to describe what you are going through. It would perhaps be the health worker who will now, given his or her medical training, who will upgrade your suspicions to a certain other level of suspicion threshold and say, maybe, given your history, given whom you have interacted with, you are likely to have COVID. Usually, these laboratory tests are to confirm.
Yeah, true.
To confirm what they are thinking, what the health worker is thinking about. Otherwise, it's symptomatic. It's symptomatic. We call it symptomatic decision making, basing on symptoms to decide on what is going on.
Okay, thanks, Professor. I think we've lost that one. Well, Mayambala, you would also note the different signs and symptoms. Earlier, we looked at dry cough, the fevers, the tiredness. We looked at...
Hello?
Yes, please.
Yes, I'm John.
Yes, John, can you reduce the volume of your TV?
Yes, I'm calling from Jinda.
Yes, John.
Yeah. I want to ask Professor, what things are we going to do to increasing numbers of COVID cases? And there are very many patients out who are not in the hospitals. Most of them are doing home-based care. The numbers in their families is continued spread. And also the numbers of community have gone high. So what is the way forward really? Because it has come to my analysis that most people from home are the ones who are being transferred to the regional referral hospitals with severe disease. And the number which are in the hospitals, big hospitals, are really high. The hospitals cannot handle.
Okay.
So, thank you.
Thank you so much, John from Ntinda. Well, I think he's asking about the measures against COVID-19.
Yeah, partly it's that, but also partly I think he's worried about the people who are in home-based care and what is going to happen. As I said, as much as possible, when one suspects that they could be having COVID, basing on the symptoms that all of us have been told, the most rational or good thing to do is to go to the nearest health center, present yourself to a health worker, describe what you are feeling, what you are going through. They will make a prescription for you. And they will tell you to go back home, maybe come on a certain Saturday for review. If they will tell you if ABCD happens, then that's the danger. Then that's when you are supposed to move to, or to be moved to the hospital. Otherwise, we cannot afford at this time to every person who tests positive to put them in a hospital or in a quarantine. As you realize now, the concept of quarantine is not there, where people were contacts, but they would be taken in quarantine, or people had very asymptomatic COVID, and they would be taken to hospital, and then they would record themselves dancing and doing gymnastics. We are not going to be seeing those pictures.
Not anymore.
Not anymore. People who go to hospital now and are hospitalized really need to be there. What I want to emphasize is that this COVID-19 is manageable and treatable if you follow the prescription and advice of the health workers. Very many people have been managed in our community, have recovered, they were positive, they finished their dose treatment, you go and test, they are negative. Very many people. So it can be managed very well for the majority of the people. It's only the small proportion that fails to be managed at home and gets the severe form that go to hospital. And their management is very, very expensive, and quite a number of them will die. But even those who survive may have lifelong complications subsequent to COVID-19.
And well, just like 50% of the people that are being tested, the results are positive. Hello?
Hello?
Yes, please. Your names and where you're calling us from?
Yeah, you're talking with Dr. Ronald from Toronto.
Yes, Ronald.
Yeah, I would like to ask Professor this question. This vaccine here, was it recommended for even pregnant ladies?
Thank you so much, Ronald. Okay.
Thank you.
Thank you very much. As far as I can recall, there was no exclusion of anybody as long as the people or the person was in the age bracket and health profile that was being covered by vaccination.
Okay.
Yeah.
So, Ronald, I think that answers your question that even pregnant women are eligible to take the COVID-19 vaccine. So if you have one, just take them to be vaccinated. The numbers are over the screen, I would say, but you can still also find us on Facebook, Google TV Uganda. Today it's Heroes Day. Ngawe natandise ngambagamba omuzirawo gyali mukubira essimu omugambe nti muzirawo. To me, the health workers, you rock my world. Muli bazira bange. Thank you so much, all the health workers that have worked tirelessly to see that people are well, that people are, I would say, well, mentally, physically, socially. Kale, you've tried so much, and big thanks to the Ministry of Health. You're really doing a great team. To the advisory committee, I'm going to ask him this question. I'm going to ask Professor this question. After the president had spoken, we were complaining. Actually, some of us went into shock. Twazemo kutegera the following morning. Tubigatagata tebijja. But and people were like, it wasn't a wise decision for the president to take. But then I'm now putting it back to you. Mwaba Avidideko president, tell us whatsoever. He told us, because you're the team behind everything. So you tell him that let's do this, let's do this. And actually, the professor has been telling me, President Waitu Mugambi, total lockdown. So meaning the president was lenient enough. Why would you suggest a total lockdown?
No, you know, the president gets advice from so many circles. There are so many advisors. And of course, she's also a very intelligent person. So after getting advice from Tom, Dick, Harry, and James and Jane, he also has to sit and reflect and take the decision that he takes, because he has a bigger eyes view of the whole country. And some of the advisors may be looking at particular constituencies or particular interests. So we trust in his wisdom. When you give the advice, you leave it up to him to take a decision. And the decision he took was, in my view, the best, in the best interest of the country, to keep the economy going, but to as much as possible try and restrict certain movements so that you can manage the pandemic within certain confines.
Okay, let me pick this caller. Hello?
good evening.
Good evening. How are you?
Okay.
Your name and where are you calling us from?
I'm Christine,
Yes, Christine.
calling from Mood.
From?
Natal.
Mobs. Yes, Christine.
I'd like to ask something, a question.
Mm-hmm.
And not before you have to check vaccination.
Is it?
Do you first have to test for COVID, or you can test for the next vaccine?
Oh, well, Christine, can you raise your question again? It's like we do not get your question.
My question is, does somebody test for the virus, or they can just take the vaccination without taking?
About vaccination.
Oh, okay, maybe if I try, you're asking that is it okay for someone to take the medication before they even test?
I mean that the vaccination,
The vaccine,
yes, before.
that is it okay for someone to take the vaccine before they are tested?
Yeah, I think the two are different. Yeah, it's okay to take the vaccine, and people have been encouraged to go and take their vaccine, and they have taken the vaccine. The vaccines, because you know the purpose of this vaccine is not to say that you will not contract COVID. You can still contract COVID even when you have been vaccinated, but it will prevent you from getting a severe form
Of the COVID.
of the COVID-19.
Wow.
It will be lighter to manage by the body. The vaccine gives the body the ability to weaken this virus so that you don't go the severe state. So I think independent of testing,
You can test
everybody is encouraged to take the vaccine and then take a second dose, at least for the AstraZeneca vaccine that we have.
Okay, let's get this one caller. Yes, please.
Good evening.
Good evening, sir. How are you?
I'm good.
Your names and where are you calling us from?
This is Apollo from Kampala.
Apollo from Nakawa. Yes, Apollo.
Kampala.
Kampala. Okay.
If you are
Yes.
your name is this? Your name is this? Your name?
Yes, Apollo.
Yes, I'm wondering why are you not having enough yourself?
Thank you so much, Apple. Apple is wondering why am I not putting on a mask? Well, I'm not putting on a mask because Professor is putting on a mask and there is a distance here and we've sanitized and literally we're alone in the studio. So I've not put on my mask, but immediately after this, I'm putting on my mask, which is here with me, Apollo. Thank you so much. Well, producer, I think I'm done with the calls for now. I want to thank people like Stephen Mayamba that called in earlier. People like Ronald from Toro, thank you so much. People like Christine Mobs Nakawa, thank you so much. John from Mutinda, thank you so much for calling. And thank you so much for being part of the show. And everyone that has been watching us, Loy Kwagala, Teddy, Disan, people from Abbey Clinic, Hajara, Councillor Irene, thank you so much, guys. Everyone that has been watching us. And but I want to note something before I give it back to Professor to give us the last words as we want to wind up the show. On the signs and symptoms, the fevers, the cough, the tiredness, the flu, let's look out for other signs and symptoms like the aches, the body aches and then the pains. Let's look out to the sore throats. Let's look out to diarrhea. Let's look out for conjunctivitis. Amaso gogetegereze bulungi nnyo. Let's look out for the headaches, the migraines, whatever headaches that you get. It might be a sign. So, as a sign, let's look out for the loss of taste or smell. You can no longer smell anything. It could be an indicator. Let's look out for any rashes on our skins or the discoloration of our skin. Kubigere oba kungalo. Those signs and symptoms, look out for them as the general symptomatology for COVID-19 apparently. So do not just go and buy drugs over the counter, but make it a point to go and see a health worker. I think consultation will not cost you. If that's if you've gone in a private setting, but if it's a health center, government based, it's free of charge. walk through, go and seek for medical advice if you're manifest with any of those signs and symptoms. Well, allow me ask our professor to give us his concluding remarks.
Yeah, thank you very much, moderator. It's very, very important, colleagues, to appreciate that we are in a very difficult situation. COVID has disrupted our normal rhythm of life. However, we should try as much as possible for our mental health and for good psychosocial well-being to remain in contact, to remain in touch. Let us not be lonely. Use your phone, call your colleagues, talk. You can video chat these days.
Okay.
You can use your computer or phone or whatever, but remain in touch, share your challenges with trusted friends. That helps, that has been our way of life. We cannot meet physically, but online presence has given us opportunity to still connect with colleagues, even those colleagues we have never met physically, but they are online colleagues. Help one another, share your burdens, share your anxieties, and let us help to calm one another down. And for when you are sharing, do not exaggerate, do not exasperate other people.
Yeah, true.
Be factual and calm down people. Don't create a crisis, a pandemonium in somebody where it is not supposed to be. That's very, very important. But secondly, to say that we are in a second wave from the history of epidemics of this nature. The Spanish flu, for example, the second wave killed more people than the first wave, and the third wave killed even more people than the second wave.
Okay.
Now we know history. So let us try as much as possible to change that narrative. We know what to expect. There is a lot of information, there is a lot of knowledge now about what to do, about how to protect ourselves. Even when we get the virus, we know how to feed, we know that doctors help, we know that medication will help if it is appropriate and well prescribed. So let us look after ourselves, do enough physical exercise, go on the sun, early morning sun, and take in adequate vitamin D. You do not have to take vitamin D tablets, actually. You can get it from the sun.
Yeah, true.
And some of the foods we eat. So just eat well, eat fruits, eat mangoes, eat pineapples.
Thank you, Professor.
You will be safe.
Well, thank you so much. That has been Professor Winston Wilson Muheza, and he's a member of the advisory committee of COVID-19 at the Ministry of Health, apparently handling the psychosocial and the mental health pillar in that area. But well, and then to the health workers, today you've been advised to make it a point that you put on 2 masks, you double mask. Actually, I've just moved with 1. I wish I could get another one. But you're supposed to put on 2 of your masks. But that doesn't mean that you should stay with them the whole day. Put on, keep changing them, but double mask. Some of you have started complaining, even 1 is disturbing. What about that 2? My dear, you will have to. So please, you've been advised by the Scientific Advisory Committee that you put on 2 masks, face masks, while you're in the clinics or wards due to your potential risk of contracting the COVID-19 virus or the infection. So double mask up for your health. Yes, for your health. Well, it's been a good day, a Wednesday, and it's a Heroes Day. Thank you so much, everyone that has celebrated it in a particular way. And thank you so much, Professor Winston, for taking time and coming through over Google TV to talk to our viewers about COVID-19. You can still make it, and we can still live in a better society and community if you and I take up the responsibility of being responsible citizens, doing the right thing at the right time. I remain Gift Nakainga. Till next Wednesday, good night.